We're talking about these things this morning. Electronic cigarettes have been growing in popularity quite a lot now, and the number of people using them, in fact, has trebled in the past 2 years to 2 million.
Yes, they're not without controversy. The Welsh Government wants to ban them in enclosed public places, and the British Medical Association says there's not enough evidence to show that they're safe. Breakfast's Graham Satchell has been finding out more.
They're vaping, not smoking, and they're not alone. New figures today show the number of people using e-cigarettes in the UK has trebled in 2 years to 2.1 million.
I smoked for years, and this is potentially better for you, I guess. You know, you haven't got any tar.
When you're smoking an e-cig, you just get nicotine and nothing else.
Despite the enthusiasm here, the British Medical Association and the World Health Organization have recommended banning e-cigarettes in public places. They say there isn't enough evidence that they're safe or effective. Queen Mary University in London. Ian is having the levels of carbon monoxide in his body tested.
So that's showing a 4 there, so that's a non-smoker reading.
Ian now uses an e-cigarette. It works by heating liquid nicotine into a vapour, which is then inhaled. The test is overseen by Professor Peter Hayek.
Many people out there think that nicotine itself is a dangerous poison, but if nicotine is taken without the accompanying toxicants, then the health effects would be very similar to drinking coffee.
So that's a 4, so that's the exact same reading as before the e-cigarette.
So e-cigarettes contain no discernible toxins or carbon monoxide. The final test, what reading will Ian get after having a normal cigarette?
So you've got a 10 there, so that's officially a smoker reading.
Experts say e-cigarettes are orders of magnitude safer than normal cigarettes, but do they work? Professor Robert West is one of the country's leading addiction experts. He studied 5,000 people who were using different methods to try and stop smoking: patches, gum, e-cigarettes and nothing. His results are published next month.
What we found was that those who were using the e-cigarettes were about 60% more likely still not to be smoking than those who used either the licensed product or nothing at all.
Despite that evidence, serious concerns remain. Does the marketing of e-cigarettes make them attractive to children? One study last year found 12% of 14 to 17-year-olds had tried them.
We already have data which can actually check this worry. If a child tries a conventional cigarette, there's a 50% chance that they will become daily users. If a child tries e-cigarettes, so far we have no evidence that they progress to regular use.
There are other worries. The Welsh Government says e-cigarettes glamorise and will re-normalise smoking. They've proposed a ban in enclosed public places.
No question that someone, looking at someone using that and thinking they're smoking. So you've got to think, well, OK, so it's not dangerous to be near someone who's using an electronic cigarette. There's really no evidence and actually very little reason to believe that it's going to re-normalise smoking. So what's the problem?
The problem in the end may simply be the word e-cigarette, the vapour that looks like smoke, a sense that they just don't feel right.
I can understand people wanting to be cautious, but if we fail to take this opportunity that electronic cigarettes potentially are providing, then we're really condemning people to death who would otherwise have lived. That's what's at stake.
Nonetheless, regulators are clamping down on e-cigarettes. Concerns remain about safety, efficacy and limited regulation.
Graham is here with us now. So they are getting more and more popular, but some people are very concerned still, aren't they?
Yes, reputable organisations like the World Health Organization, British Medical Association, who are saying we don't know that they're safe, we don't know exactly what's in these things, the regulation isn't tight enough, they are attractive to children. People tweeting in this morning saying, I don't want to sit next to somebody with this nicotine steam sort of blown all over me, which you can, completely understand. So very sort of passionate views on one side saying these things just don't feel right and we're not certain about them at all. Then on the other side, a growing body of scientific evidence, I think, which is saying that they're not that they're safe, but that they're safer than cigarettes. More evidence that they are helping people to stop smoking, to quit smoking. And people saying there's a bit of a danger that we could regulate these out of existence and there's a big potential public health prize here. I think what's interesting about the figures today is that whatever the heated debate about it, smokers are voting with their feet. 2 million people using them now. There are only 10 million smokers in the country. So, you know, the debate goes on and smokers are moving to this device in huge numbers.
Very interesting. Graham, thank you very much. Thank you.